I'm just, oh, wait, hang on one second. Okay, let me see how if I can share my screen with you guys. I've only done this a couple times, so bear with me.
And her spreadsheet is posted in Blackboard.
All right, so can everyone see this?
Yep.
Okay. And everyone can hear me okay?
Yep, good.
Okay, great. All right, so here's your quiz 9. So these are going to be the drugs that will be on quiz 9. So I kind of put them in a table for you guys to try to organize it by to kind of group it in your mind. I find when I was learning these drugs and when I'm, trying to remember things, it's nice to kind of group things in categories so you can kind of categorize them in your mind when you're studying. And if you can make connections between drugs and other things, I think that also makes it easy to remember. So I have some good clinical pearls for you guys to know in the clinical pearls section. And I'm going to be highlighting as we go through. So if I highlight something, that means that it's really important, which means you might see it on your quiz. So just pay attention to that. All right, so we'll start. First drug on the list is Levaquin, which is the brand name, and levofloxacin is the generic. It's a fluoroquinolone. It's used for respiratory infections, skin infections, pyelonephritis, and prostate infections. So pyelonephritis, for those of you who are not familiar with the term, it's a kidney infection. And then the next medication in this category is Avelox, which is moxifloxacin. So you guys probably know it by that name. I don't think when I was doing this for you guys and I saw Avelox, I was like, what the heck is that? I mostly know it by moxifloxacin. So this is used for community-acquired pneumonia, which I have abbreviated with CAP. You guys will see that a lot as you're going forward in pharmacy school. There's, community-acquired pneumonia, hospital-acquired pneumonia, and ventilator-acquired pneumonia. So you use different antibiotics for those 3 different types of pneumonia. So for this one, this medication, moxifloxacin, used for community-acquired pneumonia. Chronic bronchitis, and also skin infections. All right, so now we'll go over some of the clinical pearls. The ones that, like I said, I included a lot of clinical pearls for you guys, but I think the ones that are going to be the most important going into your first IPPE in the community is going to be the ones that you're going to use when you're counseling. So I think that knowing those is really critical. So first one is may cause QT prolongation. So I'm sure you guys are probably familiar with that already, but I'll just briefly go over it. So basically that means you don't want to give this medication to anybody that has any heart issues, that's on any like arrhythmia drugs. So any type of heart medications, you're going to want to make sure you double check and probably not a good idea for that patient population. Also, something that's really important to know is always want to pay attention to the black box warnings. So that's something to stick in your mind. That's something that could be tested on boards. You're definitely going to have it on exams going forward. So black box warnings are always important to remember. So for fluoroquinolones, all the medications in this class have a black box warning for tendon rupture, tendinitis, CNS effects, and peripheral neuropathy. So tendon rupture, this one's really important when you're counseling to make sure you mention this one. So whenever you're counseling on a fluoroquinolone, whether it's Levaquin or moxifloxacin or ciprofloxacin, those are all fluoroquinolones, you're going to want to mention to the patient that they're not going to want to do any strenuous exercise for the duration of the antibiotic. So that's important because it can cause tendon rupture, and most commonly it's in the wrists and also in the heel area, so like the Achilles. So if they do any vigorous exercise, you can cause a rupture of that tendon, and that's obviously not a good thing. CNS effects. So you would want to counsel on this for the patient to watch out for any changes in like behavior or cognition. So like anything going on with the brain. So those are going to be your CNS effects, balance, seizures, all of those things, CNS effects. Peripheral neuropathy, I'm sure you guys are familiar with this again, but I'll go over it just a little bit. So this is neuropathy is like the loss of feeling or like a weird tingly sensation in mostly the hands and feet. So we think about this with like diabetes. A lot of times untreated diabetes can cause peripheral neuropathy, but that is also a black box warning for the fluoroquinolones. Next one that's important to know is that both of these medications can cause hypo or hyperglycemia. So this is important to counsel, especially if we look in the profile and see that the patient is also on diabetes medications, because we don't want to be messing with their blood sugars at all. So we don't want their blood sugars to be too high and have hyperglycemia. We also don't want to mess with them having low blood sugars. There's a lot of diabetes medications that just one of their side effects is hypoglycemia. So to have two medications on board that can possibly cause it, probably not a good idea. Definitely something you're going to want to counsel on. We also want to take this one on an empty stomach. So that's important to know. May cause myasthenia gravis, which is like a muscle condition. That's a really rare side effect, but something to mention is one of like the serious side effects. I'm mostly concerned with you guys knowing the black box warning for this one. That's your biggest takeaway from this class. And then another good counseling point is to administer 4 hours before or 8 hours after products containing magnesium, aluminum, zinc, and calcium. So think about things like antacids and milk products, that sort of thing. You don't want to take it with like a glass of milk, or take it with like Tums or something like that. So now we'll move on to the next medication here. So next one on the list is another antibiotic, and this one is called Flagyl. And it's also, so it's a nitronidazole, that's the class, and it's an anti-parasitic as well. This one here is used for bacterial vaginosis, trichomoniasis, amoebic dysentery, and different types of abscesses. So trichomoniasis is a STD that's caused by a parasite, in case you guys were not familiar. Amoebic dysentery is like a infection that happens when you drink contaminated water, and specifically contaminated with amoebas. So think about like parasites and different like bugs. So this is like a medication that is used to treat parasitic bugs basically. But it's also used for bacterial vaginosis. So it has that antibiotic properties as well. So most important thing to know about this one, and this is another counseling point here, is it has a disulfiram effect when combined with alcohol products. So does anybody know, this is kind of weird because like I literally can't see any of you guys, but does anybody know what a disulfiram effect is?
Does it make you throw up?
Yes, exactly. Good job. Thank you for participating. So disulfiram is a medication that they use to treat alcoholism, or they either give it to alcoholics basically. So when they drink, it makes them throw up. So it's basically like a deterrent from drinking. So this medication has a disulfiram effect only in some patient populations, but you always want to make sure you counsel in everybody. So basically, if they drink alcohol while they're taking this antibiotic, they could have like seriously severe vomiting episodes, which is like obviously not good. You do not want to have that. So whenever I have a patient picking up this medication, always want to counsel on that. And it's for the entire duration of the antibiotic. And I've worked with some pharmacists actually that will tell the patient to not have any alcohol containing products for even like plus half the duration of the antibiotic. So if they're on the antibiotic for 10 days, they would say don't drink alcohol for 15 days. But I think most of the research, and that you guys can totally look this up on your own as well, but most of the research supports only the duration of the antibiotic. And when you say alcohol products, you want to be very specific with patients. So when you say alcohol, they're going to think beer, wine, cocktails, but also it includes products like alcohol containing like cough syrups. And it also can be like alcohol containing sauces. So you kind of want to just like throw that in there. And that it's not just drinking alcohol, drinking beer, drinking wine, drinking a cocktail. It can also be products or foods that have alcohol in it. So you just want to watch out for that. It's also carcinogenic, but I feel like everything is carcinogenic eventually. So most important thing here is to know that disulfiram effect. And it also increases the serum concentration of warfarin, which is important to know because if you're going to be increasing somebody's serum concentration of warfarin, that means that they're at a higher bleeding risk. So not good. So important to look into the profile when you're dispensing this medication and kind of getting an idea of what the other medications they're on. And if they're on warfarin, that's going to be a counseling point. The good thing is that when most patients are on warfarin, they're pretty closely monitored and they get their INR checked, which is a measurement of how thick or how thin their blood is, basically. They get that checked pretty frequently, but it's something you're going to want to mention to them. I usually say, when I counsel on like signs of bleeding, I usually say, you know, if you have any blood when you're brushing your teeth, serious bleeding would be like if you have a headache that's like the worst headache you've ever had in your life, that's obviously a sign of bleeding in the brain. That's not good. But I usually mention like brushing teeth, and then black stools is indication of bleeding in the stool, or like bloody stools. It's also indication of bleeding in the GI tract. So just keep that in mind. But most important thing, like I said here, disulfiram effect. All right, next one is an antibiotic. It's a tetracycline. It's called Minocin is the brand name, and minocycline is the generic. This one's most commonly used for acne. This one you could administer with or without food, but I always tend to err on the side of caution with that. I usually say you can take it with or without food, but if they have an upset stomach, they can take it with food. That sometimes helps mitigate the GI side effects. This one causes photosensitivity, which is really important to note. Does anyone want to tell me what photosensitivity is? Or does anyone want to tell the class? No?
Is it sensitivity to light?
Yes. So this is important, especially in the summertime. And I guess it depends on where you live. It could be important at any time of the year, but for here, it's mostly summertime. It can cause you to burn really, really easily. So not even like going out and laying out in the sun, but if you're just outside, you can have some serious sunburning, which is not good. So you'll want to counsel on that. So just stay extra protected if you're going to go out in the sun, to wear like long sleeve clothes or to put sunscreen on. Another interesting one about this is you're going to want to avoid in children less than 8 years old because it causes permanent tooth staining. So this is really interesting because this happens across the whole board of tetracyclines. So kind of keep that in mind whenever you hear. So doxycycline, for example, is not used in children to treat like Lyme disease because it can cause tooth staining. So when you guys are out on your IPPEs this summer, kind of pay attention to that because you'll see tick bites and like Lyme disease treated a ton if you guys don't already work in the community setting. And if the child is less than 8 years old, you'll want to, mention that to the pharmacist, and a lot of times they'll have you call on it and see if you can get the antibiotic changed to something like amoxicillin, depending on what they're treating, because of that tooth staining. So, and it is permanent too. So once it happens, you can't fix the teeth. So then they have to live their whole life with gray to brown teeth, and that's not fun. So that is a very important thing to know, guys. Permanent tooth staining. Okay. And I'm sorry my highlighter is like not straight, but I'm trying to like balance my iPad on the arm of my couch, and I have my cat in my lap, and he will not leave me alone. So I'm trying to do multiple things here. So sorry that it's not straight, but anyways, all right, moving on. Penicillin is the next one. And you'll see this on the shelf as like Pen VK, which that's not really the brand name, but you'll just see that because it has, it's the penicillin and potassium. All right. So this one's used for a bunch of different things, actually. It's used for pneumonia, gingivitis, staph infections, and also strep. So staph infections are usually on the skin, and then the strep infections are usually the respiratory infections. Biggest thing to know here is to take on an empty stomach because it will decrease absorption if you take it with food. All right. Next one here is Macrobid, which is nitrofurantoin, however you want to pronounce it. This is a miscellaneous, and this is an antibiotic, and it's used mostly for UTIs, for uncomplicated UTIs. So you'll see this a lot in the community setting. A good way to remember, something that's interesting about this drug that I think you guys should know is it's dosed twice daily. And you can remember that by the name. So let me just get my highlighter here. So you can remember that by the name. So Macrobid, BID, dosed twice daily. And there's multiple preparations of the nitrofurantoin, and how you can remember them is that the Macrobid is dosed twice daily, and then the Macrodantin is the other formulation, but that one's dosed 4 times a day. So you'll see Macrobid in the field or in your clinical setting most often, because who wants to take medication 4 times a day? Not me, not anybody that you will ever talk to. So Macrobid twice daily. So know that one. And then this one has some renal dosing, which I think is probably something you guys haven't seen yet. So I don't want you to have to remember this now, but just kind of be aware, because as you're going into your pharmacy education, the renal dosing is going to be really important to know, especially when you're in the hospital and you do your hospital rotation. They're always calculating the creatinine clearance for literally every patient that they have in the hospital. So there's this medication in particular you can't use if you have a creatinine clearance less than 60 milliliters per minute. All right, next one is Alinea, or nitazoxanide, and it's a antiparasitic. It's used to treat Giardia and Cryptosporidium. These are 2 parasites that you will find in contaminated waters. And unlike the one that we talked about before, which is the amoebic dysentery, which is a waterborne parasite, Giardia and Cryptosporidium, you can actually get this around here. So in the summertime, especially if it's a warm summer or a hot summer, you can get Giardia from lakes right here in Maine. So you guys will see if you go, if you do your IPI right here in Maine and you are at a local pharmacy, especially in like the Lakes region or somewhere that has like a nearby body of water or a camp, you'll see a lot of medications used to treat the waterborne illnesses like Giardia. All right, so this one can cause an upset stomach, so you're going to want to tell the patient to take it with food. So that's important to know for this one, to take with food. All right, next one on the list, mycostatin, which is a systemic nystatin. So there's a lot of different formulations of nystatin. You can have it topically. You can take it as like a suspension, so you can like mouthwash it. This is an antifungal, and it's used for candidiasis, which is basically yeast. So it's a yeast infection. The mycostatin specifically is used for systemic yeast infection. Okay. So this one comes as a powder for suspension, and the suspension, before it's mixed, has to be stored in the refrigerator. So the powder stored in the refrigerator, important to know. Does anyone have any questions about nystatin? I'm sure you guys have heard of that before. Any questions about like systemic versus topical, or systemic versus like just the oral? No? Yes? No? Okay, moving on. All right, so now we're into the antiretroviral or the antiviral categories. So there's 2 drugs here. And as you guys move into your drugs and disease, you'll learn all of the fun medications that treat HIV. So this is just one of them. And they usually come in like a combination too, so you'll never really see this one like by itself. So this one I always have a hard time pronouncing. It's Cellzentry, and then the other name for it is Maraviroc. And so this is an antiretroviral used to treat HIV. So there's dose adjustments for this one too for renal function. So you'll have to dose down on this one if the renal function is less than 30 milliliters per minute. Patients will generally feel so this is an important thing for you guys to know. Not to go into like all of the HIV stuff, because you guys will get that as you go further into pharmacy school, but patients generally feel like crap on HIV medications. And that's why it's really important to counsel on that, because a lot of times people will just stop taking it. And it's really important for patients with HIV to be on their medications. So that's just something to know across the board, mostly the HIV treatments and also hepatitis as well. The medications make the patient feel unwell. All right, and then it also has a box warning. So like I said, the box warnings are really important to know. So this one has a box warning for that's my eraser, hang on. Has a box warning for hepatotoxicity. So hepatotoxicity is toxicity of the liver. So know that one for this medication. Sorry guys, my dog's like trying to eat my cat right now, so I'm trying to, okay. Next medication is Tamiflu, which is oseltamivir. So I'm sure you guys know this one. We see it a lot, especially if you work in the community pharmacy setting. So this one is an antiviral, and it's a neuraminidase inhibitor. So neuraminidase, if you think about, like, for example, the H1N1 virus, the N1 is like the neuraminidase component of like the virus. And so basically this Tamiflu works to destroy influenza by inhibiting the neuraminidase. So that like N component. It's a lot more complicated than that, but that's just how I remember it. This one is indicated for influenza and influenza only. I know they were trying to use this for COVID right now, but I don't think that they've had very much luck with it. So this one's is only used for influenza, or only indicated for influenza. So important to know that this has both a prophylaxis and a treatment dose. So you guys don't need to really know the exact dosing, because you can look that up. But just know that this comes in both a prophylactic dose and treatment dosing. So prophylaxis dosing would be for somebody who, say one of their family members was diagnosed with influenza. They would also send the patient home with prophylaxis dosing for family members. So they would like also give this medication to people who do not have influenza to prevent it. So the preventative dosing is longer than the treatment dosing. So that's the part that I want you guys to know, is that treatment dosing is short, and then the prophylaxis dosing is longer, okay? And then you're gonna wanna initiate treatment within 48 to 72 hours of symptom onset. And this is like a very important point. So I'm gonna put a star next to this because it's extra important. If you do not initiate treatment within 48 to 72 hours of the onset of symptoms, you are not going to be treating your influenza. It's not going to be worth it. It's not going to treat influenza basically there's no point in taking it, because you're already past that window of being in successful treatment. So you're basically going to be taking this medication, and it's going to give you an upset stomach, and you're going to have to deal with the side effects for no symptom relief of influenza, basically. So if you start it within 48 to 72 hours, you're going to have a shorter influenza. and it's going to make your flu go away faster, basically. If you go outside of that window or later, then there's no point in taking it. So you're going to want to adjust dosing here again for a creatinine clearance less than 60. You guys don't need to know that, but just kind of keep that in your mind for later. And then also you can dose this for children, but it's not dosed. It doesn't have like a standardized dosing. You're going to want to change the dose depending on how much the kid weighs. So this is in milligrams per kilogram dosing. So this is also another important thing to know, guys, because you'll see prescriptions come over for kids, and you want to make sure that you have a recorded weight before you dispense the medication, because you could give them too much, obviously, or not give them enough. Does anyone have any questions on that? Or any questions about what you need to know for this medication? Because I feel like I just talked a lot about it. No? Okay. Moving on. All right, so these are our vaccines. These ones I get super excited about because I love getting vaccines in the pharmacy. I really think it's awesome to be able to do that as a pharmacist, so I get really excited about shots. Okay, first one is Fluzone, which is an inactivated influenza. So it is given yearly as influenza prevention. Okay, so you can give this in all age groups, 6 months and up. And Maine law requires patients to be 7 years or older to receive the flu vaccine in a pharmacy setting. So if they're under 7 years, they have to get it in their doctor's office. If they're older than 7 years, they can get it in the pharmacy. Now, as interns, I'm not sure if it's company to company, but I'm an intern for Hannaford, and I can only do patients 18 and older. So we can't do 7 to 17, basically. We can only do 18 and older. So that is important to know, is that you have to be 7 or older to receive your flu vaccine in the pharmacy. And then it gets even trickier because some patients have different insurances that require the kid to be a certain age in order to get the vaccine in the pharmacy. Otherwise, they won't cover it. So just keep that in mind. Not important to know now, but good to have that in the back of your head in case you're working in the pharmacy and are wondering why somebody with like Harvard Pilgrim can't get a vaccine and under the age of 12. So just something to keep in the back of your mind. It could be a restriction from the insurance company and not like something you're doing wrong when you're trying to input it into the system. All right, so it comes in preservative free, which a lot of times you'll hear people ask this, especially moms. They'll want to know before their kid gets a flu vaccine if it's preservative free. So the ones that are in the pre-filled syringes are actually preservative free because they're one syringe, and you just put the tip on. So that one's a preservative free syringe. The ones that are not preservative free are the ones that are in the multi-dose vials. So you'll have like a 10 ml vial in your fridge of Fluzone or Flucelvax, and then if you can get more than one vaccine out of it, then it has to have a preservative in it, obviously, to stay inside the fridge and to basically keep and not, so it needs a preservative basically. So there's also an egg-free formulation, and this is also a really big question that we get in the pharmacy a lot, people that have egg allergies, and that is called Flublok. So that's good to know. So if somebody says, I can't get a flu vaccine because I have an egg allergy, you can say, actually, you can. We can order it for you. It's called the Flublok. So don't let that be a barrier for people not getting their flu vaccine. All right, and then there's 2 formulations. Usually you'll see trivalent and quadrivalent. I think mostly we dispense basically only quadrivalent now. Quadrivalent protects against 4 strains of the flu, where the trivalent protects against 3. I think mostly the only trivalent formulation we dispense pretty regularly is the high dose formulation. So Fluzone HD, you'll see on the box. That's a trivalent flu vaccine, but it's high dose. So basically, that means patients always ask, what does that mean? I want the high test. I'm getting the high test vaccine because I'm 67. What does that mean? Basically, your answer to that is that it is the same as the regular flu shot, except it has an added immune system booster in it. So basically, it just elicits a stronger immune system response to build up a strong army of antibodies against the flu. And it's a trivalent flu vaccine. So why is it not quadrivalent? I have no idea, but just know it's the trivalent. And then also it's given as an IM injection, which you guys will learn next year how to give vaccinations, I believe. You guys will be P2s, right, when you get vaccine certified? Is that right?
Yes.
Yes? Okay. Yep, so an IM injection is given right in the deltoid, and you go just like 90 degrees right into the arm, and you guys will learn all of that later, so I won't go into it, but just know that it's an IM injection. All right. So I guess for this one, what I want you guys to know is that the high dose is for patients 65 and older, and then know you have to be 7 years or older, but for main law to get your flu shot in the pharmacy. And then I think that's for the clinical pearls. That's what I want you guys to know out of there. All right. Next one is Menactra or Menveo, which is meningococcal vaccine. So the first dose of this is given at 11 to 12 years of age. Then they get another booster at age 16. And then this is another IM injection as well. So we'll highlight that. I want you guys to know when you get the first dose and when do you get the second dose. Okay. Next one is Prevnar 13 and Pneumovax 23. So these are both used for pneumonia. So they're both pneumonia vaccines. The Prevnar vaccine is given at age 60. And then Pneumovax is given 1 year after the Prevnar. So how I like to remember this is that 13 comes before 23. So that's how I remember that Prevnar 13 is given first and Pneumovax is given 1 year after. So pretty easy. So know the order of those two guys, okay? Know the order and also know the age that you give the first one, okay? And this one is an IM injection as well, so an intramuscular injection. Next one on the list is Boostrix, which covers against pertussis, which is whooping cough, diphtheria, and also tetanus. So this is given every 10 years. So know that it's given every 10 years. And this one is notorious for causing injection site reactions. So if somebody's going to get a sore arm from a vaccine, it's going to be the tetanus shot or the Boostrix. So I usually say before I give it, I usually kind of preface it with that so they don't think that you like did something wrong when you gave them a vaccine. And they don't call you the next day and say, my arm's falling off. So you want to preface giving the vaccine with that they're probably going to have a pretty sore arm the next day. However, most patients will want to choose their non-dominant arm to get a vaccine in, but I like to encourage them to use their dominant arm actually, because the more you use the muscle, the less it'll hurt actually. So I will tell them that, and then I will let them choose which arm they would like to get it into. But make sure you tell them first before you give it to them that this one is notorious for causing a sore arm the next day. All right, so the next one is MMR2, which covers against measles, mumps, and rubella. First dose is given from 12 to 15 months, and the second dose is given 4 to 6 years of age. So this one's like kind of a hot topic in the media right now. I think especially before this whole COVID thing came about, we were talking about measles a lot. A lot of parents were not vaccinating for measles and going to schools and going to daycares, and we saw a lot of measles outbreaks. And so they were encouraging those who were older to get revaccinated, especially if they were given an inactivated vaccine as a child. So some adults, if they were vaccinated, I believe, don't quote me on this, but I believe it was sometime in the 80s. Dr. Toy, do you know exactly when they were given inactive vaccines versus the live vaccines? Do you know off the top of your head? Maybe not. Okay. But back in the 80s, sorry, go ahead.
No, I didn't remember exact timing. Yeah.
Okay, I think it was around the 80s. They transitioned from an inactive vaccine to an active or a live vaccine. So patients that received the inactivated vaccine or the not live version are encouraged to actually get revaccinated in order to be protected, basically. So the most important thing to know about this one that I want you guys to remember is that it's a subcutaneous injection. So this one is given differently than the intramuscular injection. So it's given at a 45-degree angle, and it's given on the in the back of the arm into the skin. So it's more painful, and it's more it's a vaccination technique that you don't use as often. So when you do it, it makes you more nervous, I guess, as the vaccinator. So just know that it's a subcutaneous injection. And then also make sure you know it covers measles, mumps, and rubella. So that's the MMR. And that's easy to remember, I think, because MMR, measles, mumps, rubella. But you guys don't need to worry about knowing when the first and second dose are given. Just know that it's a subcutaneous injection. That's probably the most important thing. And I think that is the end of my spiel for you guys. Do you have any questions?
All right, guys. So clinical pearls are not gonna be on the quiz. However, I think they're gonna be you guys going on to EP in the summer. So thanks, Abby.
Yes.
You know what? I think Abby was very excited to share her experience and her knowledge to you guys. So thank you for sharing it and sharing it. Any question, guys? All right, so Abby.
Okay, so am I giving them the quiz password now?
And then guys, remember that you need to know the molecular weight of potassium chloride. I mentioned 74.5. Sorry for missing that on one of the questions. So write that down. And what is the password?
Okay, password is hashtag COVID-19. And all capitals, correct?
Yes.
Yes. So hashtag COVID-19, hashtag COVID-19, all caps.
And guys, there's a 30-minute time limit. So make sure you time yourself and get it started right now. I can monitor when you guys are starting the quiz and when you're finishing it. So make sure you start right now, and then I'll be monitoring and then post the score right after that, okay? Well, have a great rest of the week, and then I'll be here. So if you have any question while taking the quiz, feel free, or after it, feel free to email me with questions. All right, guys.